know why he changed his mind. When I got up there, he said he hadn't changed his mind at all. The medical oncologist really felt like I was making a mistake by doing the surgery, and he was making that choice for me. Needless to say, I went ahead and did the surgery. And I really didn't trust that doctor again, so I didn't go back to him. But I did meet another oncologist, Dr. David Carbone, and his approach was totally different. He said, you're stage 4, and you are incurable, but you're not untreatable. And he said, what we'll do is try and starve it off as long as we can. That I could live with. So what do we know for sure? We know that the lung cancer statistics have barely changed in 30 years. We also know if we don't try anything different, we're going to continue to get the same results. And if we decide to treat the patient, or we decide not to treat the patient, or we treat them with the expectation they're going to die, they probably will. And in my case, what was critical was I didn't listen to the doctors. I didn't listen to a surgeon who said he couldn't do it. I found another surgeon. And I didn't listen to the medical oncologist initially who told me just to go home and spend time with my children. I had Dr. Ninen who was willing to try, who was willing to treat me as the patient and not just a diagnosis. And one thing I have to say about that, I think he was very courageous. This was his first year at Vandy. He was a junior guy on the playing field here. And, he was being told, you really can't do this surgery for her. But he did it anyway because he felt like it was my only shot. And he listened to what I was wanting to do. At this time, my children, I had 2 daughters. They were 10 and 13. And I wanted to see them graduate. And, those were things that were important to me, and he was willing to help me do it. I also ended up, without knowing, I didn't know this on the front end, I do now, but the thoracic patients, lung cancer patients, get their best care if you seek out the proper specialist, a true thoracic medical oncologist and a true thoracic oncology surgeon. The cardiothoracic surgeon had told me when I was talking to him about the surgery, when I asked him about lymph node resection, he said, I'll sample them, but if they're negative, that's it. And I said, don't we need to take them out? Because I'd already at this point read a few things, and he said, no, God gave them to you. He wants you to have them. So what has actually happened in my case? First of all, I had the diagnostic wedge resection in the right upper lobe, and then a week later, we took out the left lower lobe completely with the 8-centimeter mass. Then I did chemotherapy. I took Taxol Carbo, 6 rounds of it, and then weekly infusions of an EGF. And at the end of that, I still had these nodules on the right. I had some in my upper lobe, some in my lower lobe. And the company that was giving me the drug decided that maybe one of the tumors were starting to grow. And they wanted me to come off the treatment, which kind of caused me to panic. But I talked to Dr. Ninen, and he agreed to go in and do another wedge resection on the right upper lobe and the right lower lobe and get rid of the cancer completely. And what was really unique about this surgery is the one that the clinical trials people thought was growing wasn't even cancer. So the bigger one, the one we'd all been measuring, wasn't cancer. There were 4 others that were, though. There was no evidence of disease for about 1.5 years, and then I had a recurrence in the left upper lobe. This was the first time it had been in the left upper lobe. And on that one, he took the linguinal segment of the left upper lobe. That was probably my toughest surgery. I had chest tubes for 3 weeks during that one. We had a very hard time getting the rest of that lung to stretch down to the diaphragm. But eventually I recovered from it too. And then I had another recurrence about another 1.5 years later, again in the right upper lobe, and this time we decided just to get rid of that right upper lobe. It seemed to be causing me a lot of problems, so we just took the whole thing. And then my last recurrence was about this time last year. And at this time I had a radiofrequency ablation. We had it done in '08. But my reasoning for it, during the course of all this, I mean, when I was first diagnosed, I really felt like I didn't even want to go to sleep and still have cancer in my body. I wanted it out that day. And since, what I've learned is I've got time to sit back, make a good decision, and kind of analyze what's the best treatment for me. I've had 5 thoracotomies. They've taken, 60% of my lungs out. I can't keep pulling the surgery card out every time I have a recurrence. So I felt like I needed something else. Chemotherapy, it's bronchoalveolar. Chemotherapy doesn't help me. And so what I wanted to do was pick a treatment that didn't exclude other treatments, and radiofrequency ablation at the time makes sense to me. Let them burn it out. If it's not effective, I still can have a wedge resection. I could still have the stereotactic radiation if I need to. Overall, for lung cancer patients, I feel like, and I've spoke to so many, but I feel like we all share this same emotion. It's complete hopelessness. You feel like there's no really good treatments, and they talk about our survivability, sometimes not even in months, but in weeks. And support groups are just not there for us. I went to a few, what I could find was breast cancer support groups. And the best way I can describe being a lung cancer patient in a breast cancer support group would be like comparing a Whipple procedure to gallbladder surgery. It's not even in the same ballpark. For lung cancer patients, we all have tough decisions to make. Anytime you're told you have cancer, it just shakes the ground under your feet. It's life-changing. So many thoughts go through, the things you haven't been able to do so far, the things that you want to do in the future. But for lung cancer patients, I think it's just magnified, because every article and every doctor wants to tell you what the overall survivability is. And it's poor. It's 15%. I think what is crucial is communication with all parties and open discussions about all the options and all the risk. What I found was my doctors ended up listening to my fears. When I said, I don't want to be a pulmonary cripple, okay? I don't want to be where I can't enjoy life, but I want to be able to raise my children. I want to get them where they are independent, and my doctors were willing to work with me. I think the doctors in my case were willing to push the envelope. They were able to think outside of the box. They didn't just say, well, you're stage 4, we're not going to give you surgery, we're not going to work with you, your only option is chemotherapy. They looked at me as a patient that didn't have other risk factors. I didn't have heart disease, I'm not diabetic, I don't have COPD, I'm a non-smoker. And they treated me with that premise. So you wonder with the possibilities. Could we change outcomes if just patients would sort out proper specialists? I'm an advocate now. And I've gone back and I've talked to the doctors in my community. I've talked to pulmonologists who, how many times do you, make a diagnosis of lung cancer? And who do you refer them to? And one in particular, she's a pulmonologist who's about my age, and she was diagnosed with cancer of the appendix at the same time. Well, she didn't stay in Bowling Green for her treatment. She went down the road to Vanderbilt. But her lung cancer patients, she refers locally, or sometimes she takes care of them herself. She doesn't even give them chemotherapy. And I said, why are you doing that? Why don't you give them the same chance you gave yourself? And her answer to me was, we can't send our health care dollars down the interstate. They want the revenue right there. But what if patients, instead of getting surgeries from cardiothoracic surgeons who mainly do CABG, were done with true thoracic oncology surgeons who do proper lymph node resection? Could we just change the survivability just by doing those few things? Or could we change the outcome if the patients had true team approach?